Hello, I'm Sunil Aggarwal. I am a physician, and my specialties are hospice and palliative medicine and physical medicine and rehabilitation. So I have a special interest in the care of patients who are chronically, seriously, and terminally ill. And I practice at the Ames Institute in Seattle, where we do Advanced Integrative Medical Science Institute. That's what it stands for. And we do some psychedelic assisted therapies that are legal, like ketamine. And and I'm also on faculty at the University of Washington as a courtesy physician. I have a doctorate in medical geography, and so I'm really interested in the public health approach that we take. And there's a concept in what does it mean for a public health system to recognize the spiritual health and safety of entheogens. And I want to talk about that perspective briefly and introduce the concept of eco-cultural identity, which is an important part of people's identity to, the term decriminalize nature. Why nature, and what does nature have to do with our identities? So let's begin by talking a little bit about some of the Dr. Sackett alluded to some of the older and recent research studies. And in the same way, the use of psychedelic substances to alleviate symptoms of serious distress and end-of-life situations of patients has been looked at again since the 50s and 60s, very early on. And there are reports from doctors who are administering this from like at University of Chicago or in the LA area, describing the significant relief that patients who were facing mortality, like serious mortality diagnosis, like advanced cancer, how it could help them prepare for what death, the process of letting go might be like, so that when that time does come, which will come for all of us, they were more prepared. And the time between when they took that session and met their end, they had a chance to have better quality of life. Now, those were the early studies. And this sort of came fast forward to like the 2000s and after the turn of the century. So because of the bans, it was very hard to do this work, but researchers at UCLA, Johns Hopkins, NYU, at least in the US, really took these steps to actually start to apply the modern trials in patients with advanced cancer. And these studies are all very, very impressive. Then these patients with advanced cancer in randomized controlled fashion. So sometimes they got psilocybin, sometimes they got placebo. They were all, like Dr. Sackett was saying, where they were screened, they were prepared, they went through a structured process. But they were all people that were suffering from significant life-threatening or terminal conditions. These patients had significant alleviation of symptoms of psychospiritual distress. I'm going to list some of those terms for you. So things like a change in spiritual well-being, a change in quality of life, death acceptance, life meaning, optimism, and spiritual meaning. And these are various validated scales that look at these. And there's another concept that we use called demoralization, just the sense of just hopelessness and that patients often can face when they get these kind of diagnoses and undergo these treatments. So furthermore, many of the research studies also tried to kind of further substantiate how is this happening, and also how long do these effects last? And in some of the cases where patients who were still alive with a condition, like some of these lasting effects would go on for 1 year. And then, the research study has to end, they run out of money or something, but I'm sure we have data that goes 12 months longitudinally in patients like this. So that's quite significant to see those kind of enduring changes. And sometimes there's a few sessions, not just one session, but sometimes it could be just one. So that just gives you a sense of what the potential is in palliative care and end-of-life care and hospice care, where many, many patients struggle with these kind of existential issues and depression and anxiety. And we are currently working, I work through the American Academy of Hospice and Palliative Care, which is an international organization, the largest one. They have a psychedelic assisted therapy specialty group forum where a lot of folks in the field are focused on that. And we're working on a right to try effort at our clinic with the assistance of the Washington State Attorney General's office to try and secure access to psilocybin under the right to try laws, which exist to help exactly patients who are with serious or terminal illness. So those are the ways in which, in addition to this, we're trying to implement these clinical studies and make it more of an operational thing. And anyway, I won't have, but just sort of know, I think the issue, the way it works is probably through allowing greater cognitive flexibility and helping to de-pattern certain types of default conditioning that comes up. It's a trauma model. So, I think there's a lot of overlap between the psychiatric and the palliative. And then just to touch briefly on the brain injury issue. So my colleagues and I recently published a paper in the Frontiers of Neurology journal reviewing some of the studies that are looking at psychedelics for the use in brain injury. And there's quite a lot of that research is in the early stages, I would certainly say, in terms of actual human clinical studies. But there are plenty of folks around who can give you anecdotes, stories of significant brain injuries that they were able to alleviate with their own self-directed or some kind of guided use of psychedelic substances that they were obtained on the underground. And that's really a remarkable thing. When you have certain brain injuries, people are impaired for life, cognitively disabled, unable to work, unable to function, executive function impairment. So it seems like psychedelics have some kind of anti-inflammatory role in the brain, and that our body actually produces a chemical called DMT, which is one of the psychedelic substances that is being discussed. And that's actually naturally occurring, and it might be involved in anti-inflammatory effects in the brain. So more to come on that work, but there's a lot of centers already looking at it and planning clinical trials, also for stroke. So, who's to say this could also be married with a therapeutic model as well, a psychotherapeutic model too. So the third area is pain. And phantom limb pain in particular, there's been some published case reports out of UC San Diego showing patients with severe pain after amputation of a limb. This is where the brain really doesn't understand that this part of the body is no longer there. And then there's a feedback issue. And so patients do what's called mirror therapy, which sometimes helps. I don't know the number needed to treat, but it's, it is not always effective, but it helps a little. But there was a patient who used mirror therapy and also used psilocybin, again, not obtained through the doctors at the research hospital. But the doctors at the research hospital were so impressed with his relief of using mirror therapy and psilocybin that they wrote up his case, and he described in very much detail exactly how much he took. So we know from those case reports that, and then there's some work out of Switzerland showing LSD at low doses can assist in alleviation of experimentally induced pain due to really, really cold temperatures. So there is definitely something going on with the pain system, and psychedelic substances helping to lower raise the threshold or change the way the body processes pain. This is very important in the epidemic of an undertreated pain that we face today, and alternatives beyond opioids. Finally, I'll just make a brief mention about this, the public health approach. I just wanted to say that, I believe that these psychedelic substances, entheogens, are in many ways cultures have developed long-standing relationships with them, and which are in part tied to their relationship to the natural world. So you can look at indigenous North American or South American indigenous traditions of reverence of certain sacred plants that revere as sacred. And it's the same sort of sacredness that the Catholic Church might revere the communion wine. And I think it's important for us to, as a society, to recognize that in our history of, colonialism and dominant ideologies, we may have destroyed or undercut a sacred relationship that is well documented historically and exists today. And it's not just in indigenous communities. I think all of us have an identity relationship to our place in our culture. It's an ecocultural identity. It's a new concept in the social sciences literature that I think will help us stitch together all the other axes of identity, whether it's class, race, ethnicity, gender, et cetera, sexual orientation. All of these things are important in the city of Seattle. The language is very important, and disability, ability, all of that is very important and makes the city a safer place. And I believe recognizing this spiritual dimension will also assist in that as far as the identity, respecting people's identity in the city. So those are my comments for this for today. Thank you.